not going to see like this. Yeah.
Okay. So good morning to everybody. I am Carlotta Martini, speaking from the Global Spine Congress in Milan 2017. I'm here with Professor Szpalski from Brussels, and I'm going to ask him some basic questions about spinal publication and research papers in spine surgery. So good morning, Marek.
Good morning, Carlotta.
How are you?
I'm well, thank you.
Okay. So let's start with the first question. What's, in your opinion, the level of evidence of currently published papers about spine?
Well, it's usually very average. There are a lot of case series which are basically not very high level of evidence. The real good evidence papers are pretty seldom, but it must be said that doing level 1, which means a controlled randomized study in spine surgery, is difficult and extremely expensive.
Okay, thank you. And can you explain why case reports are so unuseful, probably?
Well, because they only show an isolated fact which some people saw at one moment in time, which usually is not very informative as to the general level of pathology or a disease. Well, some exceptional case reports, something the first discovery of a new pathology, of course, would be interesting, but most case reports do not bring much to the advancement of science.
Okay, that's clear. And can you explain us the real difference between review and meta-analysis?
Well, a review, I mean, let's forget what is called narrative review, that's to be forgotten, but systematic review means finding all the literature pertinent to a subject and then evaluating its value according to the evidence-based criteria, and after this evaluation make a conclusion, or no conclusion, but try to make a conclusion which is mainly a qualitative conclusion. Meta-analysis is taking the data of those papers and pooling the data with a special statistical analysis called meta-analysis and having a quantitative conclusion against the qualitative conclusion of a review.
Okay, thanks a lot. And again, about the kind of studies, what do you think about the RCTs? Are they ethical in spine surgeries?
Well,
real RCTs?
Well, it depends. If you go against a conservative treatment, they are perfectly ethical. If you're against no treatment, they may be ethical. If you go against a sham surgery, there are great discussions in there. The discussion arose years ago with the arthroscopy study published in the New England Journal of Medicine, then they came again in the vertebroplasty study. I don't think that the matter has been completely settled. There are indeed ethical issues by doing a shunt surgery on somebody, even if he agrees.
Okay, thanks. And the last question for you is, what's, in your opinion, the role for spine surgery registries?
Well, since it is so difficult to make a good randomized control trial surgery, since it is so difficult to get valid level 1 data, it is the second best thing is trying to log in all the cases you can in a registry. Ideally, all the surgery cases done in the country, the region, in the world should be logged into a registry, and that enables to have such a big pooling of data that we may get level 1 evidence out of it because of the massive quantity.
Okay, and at last, the last answer I would like to hear from you is about the non-surgical registries. What do you think about spinal patients' non-surgical registries?
Well, all treatment for spinal disease, which is a complicated matter where we are not completely sure of what happens even in the pathology, are interesting. So that's very interesting. It's maybe more complex to do than in surgery because the variability of non-surgical treatment is even bigger than for surgical, but it is of course something which is highly interesting.
Okay, so this is all for the moment. very much.
Thank you, Carlotta.
Thanks, and see you later.